And boom, we are now live. This is TikTok Live number 78. I don't know why Riverside's making it look so weird right now, but okay. Nonetheless, TikTok Live number 78 now. Pretty sweet. It's Monday night. I missed yesterday because I was out. I had a family dinner. It was great. It was very nice. Got some good bone marrow pasta. It's phenomenal. And and duck liver cannolis. If you're going here, and it was in the Westchester area, absolutely outstanding. In fact, I got the duck liver cannolis for dessert because they were so good. Yeah, and it was liver. I'm a big fan of liver. I think it's really good for you. But okay, first question in the chat. Let's get this going. Fountain 75 with the first question here. How is practice going? It's going good. It's going pretty good. The last 3 days, today and then Thursday, Friday last week, super light schedule. I was I'm always working. So like if I'm at my desk, I'm connecting with emails with other providers. I'm calling other providers, thanking them for referrals, asking about a treatment plan. I put up the question of the day on LinkedIn, on Instagram and LinkedIn. Planned this tonight. I'm always doing something, responding to comments on. Today was a lot on LinkedIn, on YouTube Shorts, and on Facebook. A lot of comments there. A little bit on Instagram, but I'm like so far behind on TikTok, guys. I don't know if any of you guys had left a comment on one of the posts recently. Guys, I'm so far behind on those, and I'm getting swamped because I'm also trying to end on board studying right now on top of work and getting the mortgage and trying to find hospital privileges so I could just schedule the boards, because they don't let you schedule the boards until you have hospital privileges. So now it's like feet on the ground, getting started in the practice. That took like a week or two to kind of like get into a routine there, but it's everything else with life, just kind of getting settled in the house out here, trying to get my fiance to move out here, trying to get the mortgage. Like I said, hospital privileges. You need hospital privileges in order to register for the board exam part 2, and that exam's in February. So yeah, just wow, lots going on. And hopefully that answers the question there. You know what I mean? Apple user 383544243. How much do new OMFS usually make? Well, I saw offers as low as around $50,000. This is an offer as of the last 2 years, and this is in the New York area. Okay, $300 to $4,000. With some bonuses, some practices in the last year were even offering up to $425, $450. This is in the New York area. Otherwise, in other parts of the country, I had a chief who signed with a practice down in Florida for $750,000. He did, yeah, excellent. He did really well. Got a really nice practice Monday through Friday, no call, just very, very good oral surgery procedures. Good for him. He earned it. He looked for down there. He had family in the New York area, but he did it and went for it. I saw up to 800,000 in the Midwest, like Wisconsin. I saw 650 down in Alabama. I saw, New York, California, that's anywhere between like 350, 450 ish, maybe 500 if you're lucky. But 500 in Maryland, I saw. So you get an idea. But here's the thing though. Don't fall for the salary. Don't fall for the base. You really want to look for the percentage, right? That's the only way you get a percentage of all the work you do. If you're just getting a base and you're going in the office every day, the incentive is not to work hard. It's not to make more. It's, you know what I mean? So it's really the percentage. The percentage I got is 40%. 40% is a really good percentage as an associate in practice. An associate position is when you work for other people or someone else. I work for one owner, one boss, and 40% is really good. A lot of the other places I saw are 30, 32%. I forget if I saw 35, but yeah, 40% is only seen at Aspen Dental here where I'm at All County. I forget if it's Premier, maybe Leading Edge oral surgery has 40%. And then there's another group out west. I think it's like OS1. I might be wrong, but yeah, very few have that high of a percentage, 40%. So that's really important. Okay, that's really important to consider, because then you get a piece of all the work that you do. If you're getting a salary, they're going to try and overwork you so that you're bringing in more money than your salary is producing, right? That's the name of the game. 40% is usually better. Much fairer offers that way. M Fountain 75 said, is it better than residency? Yeah, this is exactly what I want to do. I want to do bread and butter, surgery, teeth, titanium, sedations, implants, actually wisdom teeth, complicated extractions, and build my reputation. Had a really, really, really nasty patient today. Just kind of just berate me and degrade me and pretty much yell at me. And it was pretty nasty experience after I was being very kind and, just saying how it is. I do need, some cooperation and listening to instructions, especially during surgery, because you're with sharp instruments. Someone could get hurt, whether it's you, the patient, or, our assistants or team. I just, at a certain point, if I can't have a certain level of safety during a procedure, I can't do it, and I make sure that's very clear, because this is surgery. This isn't This isn't like, we're not walking into Chuck E. Cheese right now. This is serious, and I need a certain level of understanding where, I can perform the surgery safely. If I can't do that, I don't do it. So, but some people, I guess, the level of entitlement and being given, and they finally aren't given what they demand, what they want, and then they lash out. They say really nasty things, but thankfully, I do have thicker skin, having done a residency at partially at Bellevue, and I don't think it can get any worse than right there, the way you get treated by patients. And so that was that. It still affects me. It still affects you. You want the best for people. You want the best for patients. So for someone to treat you like that and talk to you like that, it's degrading. It's very frustrating. It's disappointing. But anyway, let's move on to the next question. Otherwise, in Fountain 75, it is better than Residency. So much more. I mean, I'm willing to work so hard because I actually get paid for it now. And why would I? Yeah, so much better. I got to say, though, unexpected. Days are going long. I finish at 5. Like, I didn't finish surgery until 5:30, 5:45. I didn't get out of the office till 6:30. And if it's a 9 to 5 right now, Monday through Friday, which I want to get to 8 to 4 after the boards exam. If I decide to take this boards exam, here's another thing. If the board exam is so hard to schedule right now, I already paid $3,300, so $3,300 just to schedule it, but they're not letting me actually book the exam, part 2 of the oral surgery boards exam, the oral board exam, the hardest one. They're not letting me schedule it until I have hospital privileges. Mind you, hospital privileges around here on Long Island, they don't pay you to take. They want you to work in their clinic one day a month. They want you to pay an application fee, like $200 or more in application fees. Take off a day of the week, take off a day a month to cover in their clinic, and I get it and everything, right? But they're not going to pay you for that, and you have to take call for them, whether it be a couple weeks or a month, a year, and they're not going to pay you for this. And I have to get this in order just to schedule for the boards. And then what do I get? Say I'm a board certified oral surgeon. I totally believe in it. I think it's really good to test someone's knowledge to make sure that they're ready for high level oral maxillofacial surgery. To be a board certified. I think it's very important. But what do you actually get from that? Do you get higher reimbursement from insurance companies? No. Okay. Do you get to just walk away from insurance companies, go fee for service if you're a board certified oral surgeon? No. Okay. Okay. Do you? Can I? You know what I'm saying? Like, do I get paid more being board certified? Do I get? No, it's really just kind of a marketing thing to say that you're a board certified oral surgeon, that you're to the board of oral surgeons in the United States, that you're equal on an equal level as everyone else that's board certified. But like, you see what I'm saying? It's like you don't get reimbursed, you can't get off insurance companies with it, and your malpractice insurance doesn't go up higher if you're not board certified. So they've made it so stressful, so hard. And stress can be good at times. I get it. That's not what I'm saying. You need to learn things, right? And be considered a good oral surgeon, a good surgeon. That's very important for patient safety, for, good to perform good surgery, safe surgeries. But like, if there's no benefit to actually getting it, and they're not supporting surgeons in areas like Long Island, where you're not getting paid to take call, and it's just like money out of your pocket to do this, and like, you know what I'm saying? Like, what? So then, what are we doing for anymore? I don't know. Life would be so much better if I wasn't trying to push, trying to find time to study, trying to just get the boards scheduled because they're not letting me do it. Life would be so much better. And I'm at the point where it's like, why so much friction? You guys ever get to that where it's like, literally, why so much friction? Constant friction. No, I have enough of the friction. And if there's no benefit to actually doing the friction, why do it? You know what I'm saying? I don't know. All right, let's move forward. Jfcjdbddj, what's up, man? He said, "Hey Doc, have you been? How's work? It's good. It's good. It's busy, but this is I just mentioned some of the things going on." Sebastian Escobar, how to prepare for the CBSE? CBSE, any paid courses? UWorld questions and the materials. Go look on YouTube. CBSE dissection. Look for CBSE dissection on YouTube. We even did it on your podcast platform. Look it up on Apple Music, Spotify, whatever you like to listen to, watch things, because we put out the video version as well. Me and Brandon Axelrod, he's a resident at Cornell in Manhattan now. We made this a year and a half ago. It's got all the updated version of materials, how to study it, and how to crush that exam to the best of your ability, okay? And we got a lot of good feedback on it. So I would follow that to the T and do it. All right. Blake said, "God bless you, brother. Hope life is going well. Love watching your content." Blake, thanks, man. You too, brother. I hope you're doing well, man. Anytime you want to talk, you want to chat, you want to do the podcast, dude, just let me know. I want to see you succeed. All right, man. Zayed Hussein said, "Do you do your own sedations?" Yes, I do. Once I finally get my anesthesia license, it's been almost 2 months since I got my New York State dental license. So we'll see. Diz_Lexus said, "What was your DAT score?" My DAT was, why is this so high up? I feel like that's like too high. The DAT was a 21 academic average with a 22 on the PAT section. Stinky Boy 69 said, stop doing form impacted thirds for $700. You're putting your license at risk for garbage. Stop rage. You're right. You're right. You know what's even worse? I saw the other day that sedations by that same insurance company were reimbursed $62 every 15 minutes. That is not worth doing sedation. For that is not the risk that you have during sedation. $62. I'm sorry, that's just not worth putting a patient to sleep and risking the patient's health, risking your life, risking, that's too risky for $62. That's a problem. So yeah, $700 for fully impacted wisdom teeth is bad, but $62 for every 15 minutes of sedation, that's the worst I think I've heard out there. And he said, please keep making content until I become an OMFS. Yeah, you got it. Third Molar said, I'll get used to the abuse. It gets better because you want that everyone is going through that, because you learn that everyone is going through that stuff. Yeah, true. That's true. Yeah. Stinky Boy 69 said 6:30 is long. What? 6:30? What? Wait. 6:30. Yeah, that is a long day. Like no phone calls, catching up on emails and stuff at the end of the day. Yeah, that's a bit long. I missed the workout today, but Sebastian Escobar, bro is a pro app. All right, Deep VT said, "That's funny. That's really funny." Hey, I was just letting you know. Yeah. So I was just letting you know how it was going. Third Molar said Sebastian Escobar with the laughing emoji. Deep VT said most surgeons around me are so busy. 10 to 12 IV sedations per day, CRNA on Fridays. Yeah, that's pretty good. I would like to get that many IV sedations per day, but we're starting out, just starting out. Pretty underscore Rosa said, is it possible to do the 4-year OMFS program and do fellowship in cosmetics and do certain procedures? Yeah, it is. For example, rhinoplasty. Yeah, you can do that. No problem. That is possible. No. Evan Dickens said, I went from age 4.8 to 17.5 without dental. My teeth are bad. Where does one start? I would start by getting a consult at a general dentist. Yep. Tyrone Long said, hey Tyrone. John Watts said, what's a good CBSE score? 70 plus? Yeah, I would say 70 plus. Still pretty good. Tyrone said, I haven't seen you since 08. Best prison wife I ever had. Wow. Imagine that. Oh, wait. I was just starting high school at that point. I was about 12, 13 years old. Oh, wow. Manny, what were your habits during undergrad? What do you mean? What were my habits? I would try and get a workout in every day. I would work out for an hour to hour and a half. Back in undergrad, wow, I was running and doing a full workout lift. So that was like an hour and a half, 2 hours, if I think about it. Otherwise, I was in a bunch of clubs. I would study for tests. I was still making flashcards, like written flashcards back then. I wish I knew about the app Quizlet, because that would have solved a lot of time problems. You know what I mean? Time issues. But Sebastian Escobar, do you think all these issues with getting your license and boards is based on the state you live in? Sebastian, I think you might be getting somewhere. Bobby Schmerd said, would you practice in a rural area? Yeah, I would. I mean, I'm suburban right now. I would go rural. I would go urban. I just want a good quality of life. I want to be around my friends. I want to be around family members. Good cost of living would be great. New York does not have that. We'll see what happens. We got to see where the politics go in New York and for the future, because it's changing. The man Lewis said, what are your thoughts on ozone treatment rather than root canal treatment? Ozone treatment in the root canal? I'm not sure. I'm not familiar with that, actually. Jerome said, if you could go back in time, would you choose OMFS again? Why or why not? Within dentistry, yes, I would pick OMFS. I would pick oral surgery within dentistry. If not OMFS, back to the beginning, it would have been GP or oral surgery, one or the other. So Jfcjdbddj, have you gotten your anesthesia license already? No, I have not. Still, it's been a month and a half. It's been a month and a half since I got my regular license, and I'm not the only one. There are other people in my practice still waiting on the anesthesia license. How are sedations in private practice if you compare to residency? Yeah, I haven't done any sedations in private practice yet because I'm waiting on the sedation license. But yes, I'll have to let you know. I don't know. Hey, so do you recommend 4 or 6 year OMFS program? I recommend you doing like what you really kind of connect with most. I did the 4 year because I only wanted to do the 4 year. I didn't want to take more. Medical school exams, step exams, health exam. No, dude, oh my God, give me a break. No way. No more exams. Come on, let's move on with life. Dream sponsored by Tylenol ad. What? I don't get it. It's underscore me. What was your GPA and how did you receive? And did you receive a bachelor's or master's degree? I didn't get a master's, just a bachelor's. My GPA ended at a 3.6. I graduated from Stevens. I did my first 2 years at NYU Poly. I had a 3.4 there. and I had a 3.8 from Stevens Institute of Technology in Hoboken, New Jersey. And when I graduated from there, it averaged to about a 3.6. So he said, at the man Lewis, witchcraft. Sebastian Escobar, do OMFS make more money in rural areas? Yes, they do. They do. Dentists in general make more money in those areas. It could have to be with cash payment payments. Insurance companies seem to reimburse much more, I don't know, smoothly in rural areas. I don't know. They don't. Maybe it's just by state, New York, California. Maybe they're not reimbursement well. It just keeps going down. Like Medicaid B has decreased 33% since 2001. I don't know how they expect the profession to keep going, like to continue at that point. You know what I mean? Like that's just insanity. All right, we are up to M Fountain 75. What's the hardest thing about private practice? I would say the hardest thing about private practice, I mean, networking and getting connections with referring dentists is good, but I like that. I really like that. I think the biggest thing is, especially you notice this with certain insurances that you take, some of the patients can be, like today, very, very challenging to deal with and treat them respectfully and professionally, and you just get spat in the face, whether it be literally or it be figuratively, verbally, like verbally screamed at and just degraded. Like, how are you a dentist? Like, this is ridiculous. You don't take care of kids well. Like, I'm not taking care of your kid at all right now because they can't cooperate and undergo surgery safely. But yeah, it can be tough. And then finding out that whole case, that if it was to go through, it would have been like $30. I'm not kidding. And so to have to take all that and then like you're only being reimbursed not enough to even pay the staff for that visit, that's a hard thing to swallow about private practice, is the insurances, what the reimbursement is. And then unfortunately, yeah, some patients are amazing. They're so sweet, so kind, so generous, so like very respectful. And I love to work with them. You know, we're here to help you, but then just some people, some patients, they just want to scream and yell at you and walk all over you, really. And then even at the end of all that, like ask for a discount. Like, whoa, as if I can give out discounts. Yes, sir. 5435, follow the live creator. Thanks, yes, sir. Thank you. Hayes, recommended GPA for applying to residency. Just do the best you can. Guys, don't compromise your personality. Like, don't think that you're going to cut corners or something to get better grades or GPA and get into a residency. Okay, be a good person, be a good classmate, be a good teammate, be a good provider, right? Learn as much as you can. Get the highest GPA that you can get. You know what I mean? You can't always just control like things like your GPA or test scores, right? You can give your best effort, prepare, study hard, and what you get is what you get. You know what I mean? Do the best you can. Manny said, best dental schools to apply to right now, and what would you do as an undergrad to be accepted? I would major in what I need to major in, or minor in what I need to minor in. What I mean, like what you need to minor in is in like, if you were to apply to dental school, you need to hit all your prerequisites. So take all those classes in the prerequisites. It doesn't mean you necessarily need to major in that subject, though. Minor in it, fine. Major in something you're passionate about. Bring that to the table. Maybe it's cooking, it's culinary, maybe it's agriculture. Princess Perio was, I think, agriculture major. I had friends in my dental school class. They were a professional pianist from Juilliard. Another one was an accountant. Another one was, you know what I mean? Like, you could do these things. Do something you're passionate about. This is what's going to come up on your interview, in the conversation, right? To talk about things that you're passionate about. So make sure you don't run away from your passions. Those are going to be the things that you remember for the longest parts of your life. And it's going to be what you're talking about on the interviews. You know, you want to display passion and you want to be engaging on that interview conversation, right? So, yeah, I probably would have done more with music during undergrad, to be completely honest. I probably would have minored in what I needed to do with pre-med or pre-health or pre-dental, and maybe done more with music because I love music more than anything else. Actually, I'm loving podcasting too. I like podcasts and I like music producing. Those are my two favorite things. I do love surgery. I really do. But there's just a lot of stuff that comes with the surgery, and, you know, insurance is the problem. Insurance is the problem from top to bottom. All right. Manny just said that. AJC, thoughts on Lafort in general? And in my case, I'm a class 3. Okay, so you have a prognathic mandible, but it doesn't really impact my profile. So I guess you were proposed to get a Lafort so they can move your maxilla forward a touch to align with your lower jaw. I mean, it's a great case. It's a beautiful procedure. You can change patients' lives. If you can't see it from your side profile, then it sounds like it's pretty minimal. And this is not a minimal surgery. This is a very maximal surgery. This is one of the most invasive surgeries we do in oral maxillofacial surgery. So I would come prepared. I mean, you could always go get a consult, see if they would consider doing that surgery. But yeah, I mean, it's a big procedure, you know. Terry said, don't take Delta. I've been hearing that a lot lately. What do you do though when you're starting out? You just not take insurance? It's not like, you know, and I want to serve the community. I want to serve the public. I'm in my almost hometown area. You know what I mean? But Yeah, the insurance lack of reimbursement is just almost impossible to do this. Sows said, I got accepted into medical school. Congrats, Sows P. Congratulations. M. Fountain said, how many implants do you do in a week? It depends. Some days like one day I got 4 in a day. And then I think last week I got maybe 3. So it's pretty variable. I would say I would say probably a handful right now in a week's time. And I got to hope that patients are willing to, put forth the finances to accept that in certain circumstances, not every patient can get an implant, and not every situation an implant is best for. You got to. I tell the patients who an implant at that time and date and has good bone that this is the time to get the implant, and not most patients they can't put that money forth. You know what I mean? It's $2,000 for an implant. It's up to $800 for bone grafting. That's a lot of money to put forth, but it is generally, if you have good healthy bone at the time of extraction, that is the best time to put a dental implant in. So let's keep moving. User 5273 Sows P in September. Sounds like they did it. User 52738. Is it common for dental practice owners to struggle financially? That's a great question. I don't know. When you're taking insurance, yes, 100%. You're going to struggle if you're taking insurance. If you're not and you get a good patient basis, you're off insurance, it's fee for service, well then, you decide how much you want to struggle or not struggle, I guess. EJC said, appreciate it. Nice. The Fragrance Space said, are you still in debt? Right now, yeah, I have both credit cards to pay off right now still. Probably going to take another month to 2 because I want to get to the point where 50% of my salary goes just right into savings, whether it be crypto or other stocks or ETFs. I like ETFs a lot. VOO, that's my favorite ETF. And my favorite crypto is really Bitcoin, but I'm also liking Papple. Pat the dentist talks a lot about that. So I like Papple and I like Dogecoin. I do. Those are my top 3 favorite cryptocurrencies. And then my favorite stock right now is just the ETF, VOO. It's the S&P 500 ETF. Warren Buffett recommends that. And I just reinvest the dividends. Those are my 2 go-tos. And yeah, we'll see. I want to put forth 50%, but right now with the credit card debt I got to pay off, probably going to be less than that per month right now. And then eventually I will in the future. I'm going to have to put forth a significant amount of money for my wedding. So per month, I got to put forth like a good chunk for that in a year and a half. And then I'm probably going to have to get a new car. My car right now is, it's a nice Acura RSX, the stick shift, but the air conditioning stopped working. So sure, I'll be able to use it in the winter and stuff. I guess maybe save a little bit, but I mean, the last week's been pretty warm. The last 2 weeks have been like pretty chilly, but like the last 2 weeks have been pretty warm, and I need some air conditioning to go. I can't arrive to work all sweaty, you know. Dot said odds of matching into the 6-year with a stacked resume, but a 68 EPC. You got a shot. I would, apply to programs that you want to go to. Hopefully you did enough externships where they get to know you, get to meet you, and things look good. But yeah, you'll be all right. It'll be okay. How do I zoom out of this? I don't know. It doesn't look like it can. Davey said, hey, when can I shadow you? Let's do, if that's okay, let's do after my board's exam in February. Okay, because now I'm still waiting on certain things like mortgage payments, getting the board scheduled, waiting for hospital privileges, waiting for my anesthesia license. There's a lot at play right now. And I need to hone into, let me get in a good pace after I get my sedation license. That's going to be a couple more months. And then after boards in February, should be smooth sailing. Okay. If that's okay, Davey. Sal's P said, I want to be a family medicine doctor and start my own practice. How hard is it to get insurance? I don't know. It's not coming up. That's pretty tough. Family medicine also very hard to make any money with Medicaid and other insurance reimbursements. You are, I think, the worst in all of healthcare is a family medicine doctor insurance reimbursement payments. Unfortunately, I'm serious. I think that is the hardest way to make a living. Unfortunately, it's just, yeah, not great. Kim, can you please can you repeat those? Please repeat what? Can I repeat what, Kim? Let me know. Amar Hassan said, I'm doing my first upper clearance tomorrow. Any tips? Upper clearance? What do you mean upper clearance? Upper clearance. What do you mean upper clearance? What does that mean? Sarah Maz said, have some OMFS interviews, and I'm so scared of getting specific pimping questions during them. Well, congrats, Sarah. Well done. That's an exciting time. And yeah, I mean, you're always going to be nervous, right? With those, you just kind of do the best you can. I didn't get many pimping questions. I didn't get any pimping questions, so good luck. Hopefully you're good. Jack Lumby said, hopefully starting dental school next fall. Should I work in dentistry this summer or take time to chill? Both. The reason why it's good you said hopefully starting dental school next fall. So I'm assuming that you still have to take interviews maybe. Congrats if you got those interviews. starting dental school next fall, so you'll be interviews right now. Yeah, I would work for a dentist. Do as many days as you want to put in. It's good to know the lingo, the certain terms and terminology for things. It's also good to, you're going to be a step ahead when you start dental school, when you already know how to talk dentistry, when you got exposed to it this year. I think it's a really good idea, but definitely do take the time to chill that you want to do. Do the things that you want, travel a little bit, expand on your passions and hobbies, because this next year is the last year you're really going to be able to do that. I'm letting you know right now. Once dental school starts, you're kind of in the stream of the educational process, and the next time you get to look up, you're working full time with responsibilities. So consider that, make the most of it. You'll be fine. All right, Jack. User 52738. So medicine would have a stable, guaranteed financial return compared to dentistry. I don't think that's what I said before. I don't think that's not what I said before. Kim said the stocks. So for crypto, look, this is not financial advice, or by any way am I a broker or whatever, but my three cryptos that are my favorite are Bitcoin is my number one favorite. Ethereum is good, but I haven't bought Ethereum. Papal, like a less known one. And then I also have Dogecoin. Those are my top three favorites. And if I had more money to throw in crypto, I'd probably go in Ethereum. That would probably be it. Yeah. Maybe Solana. Solana went down, it went up, and then went down, and now it's going back up again. And then for stocks, I like the ETF VOO. It's the S&P 500 ETF. User 12836. Also, Investors Business Daily. I would look into that. Those newspapers come out at 7-Eleven every Sunday. Otherwise, you could get the premium, the app that they do it on there. I think that's a really good. I like the newspaper. I think that's a lot of fun actually to look at the stock trends week to week in Investors Business Daily. I think they do a great job, and I'd like to invest using that one day. Again, I'm actually excited to do that with my fiance if I can. User 128362. Mike who cheese stain key for dental school. What? YK.schlock said, when you start considering financials, if you plan to attend dental school, I'm a sophomore. Always. I mean, it's always important to consider, what your financials are going to look like. It's always important to concentrate on your financials. The most important thing to consider with financials is how much money you got coming in every month and how much money you got going out every month. And then you could break that down into week by week, so you could kind of keep an eye of how much beer did I buy this weekend? How much gas did I get? How much did I spend on groceries this week? Stuff like that. You know what I mean? That's really important fundamentally that you should know and work on as early as possible. Kim, I'm also using the S&P, and I think it's great right now. I think it is great. I think VOO is excellent. And you get a dividend. Just reinvest that dividend. Just keep dumping money into it. Visa says, what are your title? I'm a oral maxillofacial surgeon. Oral surgeon is fine. Terrell, like the live. Thank you. All right, friends, time to go eat dinner. We're at about a half hour. Thanks so much for coming on. These TikTok live sessions. I hope I can leave an impact. Maybe I can help some people out there, and I appreciate when you guys come out to hang out. Tonight's Monday night, so I usually do them Sunday evenings. But if I miss Sunday, I try and get them in Monday or Tuesday night to do this. And I'll post the live recording sometime tomorrow. If I could get a chance to sit down, I'll post this tomorrow. And this is TikTok Live number 78, the top 5 listeners. I give you guys a shout out in the caption of the podcast. So YouTube podcast, I'll be giving you guys, the top 5 listeners tonight. I'll be giving you. TW said, which year of dental school was hardest for you? D3 year. Kim said, I am the hygienist. I'm the hygienist, so I got to use that hygiene money to invest. LOL. That's it, Kim. Where are you, Kim? Are you on Long Island? If you're on Long Island, let me know. Comment on. I'll be posting this TikTok Live number 78. All right, guys, time to go eat dinner. It's 8:40 now, so I got to get ready for tomorrow as well. All right, guys. Good night. Thanks so much. Love you guys. Top 5 listeners. I'll be putting on the caption, giving you guys a shout out, and I will. I'll see you guys soon. All right. Thanks again. Thanks so much for coming out and hanging out. All right. Good night. Have a great week.